I'm going to give you guys just some general information at first, talk a tiny bit about the current vaccines we're using. Today, St. Joseph County made a big announcement that we will be actually starting Monday, March 1st, we'll be doubling the amount of individuals we can vaccinate in a day. We will be changing which vaccine we will be giving. So I'll talk a little bit about that. We'll be looking to schedule and push through 1,000 people a day, which again, that's really the key to controlling the pandemic, controlling the new variants, in those types of things. So I'm Robin. I'm the Director of HOPE, Health Outreach, Promotion, and Education at St. Joseph County Department of Health. So I am our outward-facing arm of the department. I've been with the department just over 13 years, well, probably close to 13 and a half years now. This is technically my second pandemic. Just hasn't lasted. The first one didn't last this long, but right after I had started at the Department of Health shortly before we had H1N1, which was very different, but also was controlled through the use of a vaccine, which was easier to develop because it just took a minor shift in the vaccine, where this vaccine is a completely innovative approach to vaccination. And I'm going to share, I think, some of the exciting aspects of the fact that this, so I guess some of the hopes for the mRNA technology. And we'll cover some of that too, as I won't go into it super deep today, but when we go through the rest of the series, we'll touch on pieces of these a little bit more in depth. So, and I'm hoping for the next ones I'll have like some graphics and a few short video clips so individuals can see. Because I'm personally a visual learner, so I'm like, can I chart that? Can I make a flow chart? Can you show me, like, when I had to first, my role currently with the vaccine clinic is coordinating all of the volunteers and making sure that our shifts are taken care of each day. So now I'm basically going to spend the next probably 72 hours increasing our capacity through the use of volunteers, since we will be extending clinic hours and maximizing people. But we will have be able to cover a lot of those things. And Suzanne, I'll cover your question too, because I think that's extremely important. So yes. So all the media, education, all those types of things come from myself and my team. And I'm very thankful to the library, not just for their support in helping individuals get registered and scheduled for the vaccine, but really to hosting us. You know, I told Sarah, I said, even if it's a small group, I don't mind. I'll do this every single week if I have to, because I do really want people to value the benefit of the vaccine, right? It's not me coming on saying, you should get the vaccine, you have to do this. But I really want people to see the value in it. Most of us are done. I think I came back from maternity leave when I issued my very first press release about COVID-19. And my son is 16 months old now. So yeah, it's tiring for, I think, for all of us. And as tiring and the pandemic fatigue that most individuals feel, and the bombardment of the vaccine information, what works, what doesn't work, it's hard. How do I know what to read and what not to read? Is really key. And when we think there's two current vaccines that are authorized for use, that's the Moderna and the Pfizer vaccine. Commonalities are both of them have 2 doses. The difference is Pfizer's a 21-day delay, so your first dose and then the 21 days until your second dose. And then with Moderna, it's a 28-day delay. Now, we've found through, again, when we did the vaccine trials, we are still studying individuals that did the first vaccine trial. So the cool thing is we have 30,000 people who were ahead of the game. And we're finding out new information as we go. Indiana has vaccinated over 100,000 Hoosiers fully. So that means over 100,000 Hoosiers have received at least 2 doses of one of the 2 vaccines, which in the grand scheme of things, Indiana, 6.2 million individuals. It's not a lot, but when we think about it, wow, we've gotten through over 100,000 people, and we expect to exceed that each week as we move forward. And now that vaccine allotment has all of a sudden increased, which is great. But we have those 2 vaccines with the 2 doses. Some people ask, well, what if, especially right now, our eligible communities are based on age. So we vaccinated our oldest part of our community first. We've received a lot of questions as to how that was decided. The local health department does not decide eligibility. The state Department of Health decides eligibility. And each state actually decides how their eligibility will be casted, so to speak. And Indiana saw that 93% of their deaths throughout the pandemic occurred to individuals over the age of 60. So that was the approach they were going to take. They were going to age in individuals for eligibility. Do we feel that was the right approach? Would we have done things differently as a local county potentially? But it's hard to say, right? Our ultimate goal is to stop people from dying as a result of COVID-19 infection. And we saw the majority of that was our older adults and our individuals living in long-term care facilities. Do we wish eligibility would open up quicker? Oh, yes. Hands down. For every teacher I think I speak to on a daily basis who's like, just give me my shot already. I'm not good with exclusion, so I don't know why they decided it was me who had to tell people when they weren't eligible, because it literally breaks my heart to tell somebody they can't have something, because it's just not how I work. So with more vaccine, eligibility will be increasing tomorrow. That might be embargoed, but hey, you heard it first. By tomorrow morning, you'll hear it. And so the age group will go to 60 and older. So that'll be a really good segment, because what's exciting is after that comes hopefully those those essential workers, teachers, grocery store, restaurant workers, all of those individuals, as well as those with any sort of chronic condition, is really what we're crossing our fingers for. The State Department of Health does have a distribution plan on their website that they've held very true to. Probably not in the timeline perspective. I don't think Indiana expected there to be such a delay in the amount of vaccine we were given. That's, I think, been the biggest hiccup. I think they assumed that by March, we would be vaccinating everyone who would have at least some sort of chronic condition known to put themselves at an extra risk for COVID. So that's that aspect of it. So COVID vaccine kind of right now looks like eligibility for individuals 65 and older, tomorrow 60 and older, and then healthcare workers that are, of course, frontline, first responders, funeral directors, since they deal with individuals that, potentially have body fluids and that type of thing that they could be exposed to. And you can look online on the rshot.in.gov for full eligibility. Or before I leave today, I'll put my number and my email in the chat, and you guys can reach out to me directly if you have questions. And then we've also had questions about like our standby list. So what happens in the event there's extra vaccine? There is a standby list. You can put yourself on that standby list. It is also prioritized by age, but it's for individuals who are not yet eligible, but they're close to being eligible. So for example, tomorrow, a lot of 64-year-olds are going to be super excited that they can now go in and schedule an appointment rather than having to wait. So the good thing with that is now our standby list opens up to a younger age bracket. We're pretty good at keeping our our vaccines in line, so we don't draw up extras that we will have to use. But once you open a vial, if you pull only one dose out, you're going to need to use the rest of that vial. You can't put a cap back on and put it away. So that's important. So the two vaccines both utilize an mRNA technology, which actually is, so mRNA is a messenger RNA that when entering the body will actually tell your body and your cells to produce an antibody that will pick up the spike protein that's identified on top of the coronavirus. Like most of you have seen, it's the round, spiky, like kind of think of a Lego, right? Little Lego pieces all over it. Our body will actually begin to develop that antibody because the messenger RNA is telling us that, hey, you need to start making this. And where that differs from traditional vaccines is in the past, most vaccines had some sort of the virus particle or bacterial particle. Almost always those are dead, so they're not going to cause infection. But the difference is that we needed a carrier to grow that vaccine, or I'm sorry, yeah, to grow the vaccine, so the virus for the vaccine. Most times, like the flu vaccine, for example, uses chicken eggs, right? So we utilize chicken eggs to grow the pieces of the virus we would use in the vaccine to ultimately inoculate somebody. And then the body goes, oh, wait, this is foreign, and it builds a immune response, right? Some people say, I always get sick after I get vaccines. Well, not necessarily are you sick, but your body is producing an immune response. And those small side effects are your body telling you, hey, I'm working and I'm doing what I need to do. The cool thing with the mRNA technology is since it's telling someone's body to do something that the body's very well conditioned to do, is we do see a lot less adverse reactions. And I know the very first people that were vaccinated, they're like, oh my gosh, there's anaphylactic shock. That's actually happened only in a couple hundred people. When you think of everyone who's been vaccinated, believe over 1 million people now within the United States have been vaccinated. That only happened in a small subset of individuals who had known severe allergies. So they carried an EpiPen themselves, or they knew they reacted to vaccines in a certain way. For example, Dr. Mark Fox. Most of you are aware who Dr. Fox is. We were concerned because in the past he's had reactions to vaccine. So when he did his vaccine, we made sure that that Dr. Einters was on hand. We brought him in like towards the end. So in the event something did happen, we would have enough people on deck. So anyone who is concerned because they've had reactions to vaccines doesn't mean you can't get it. We just ask that you tell us that you've had those types of reactions so we can be best prepared to help. Now, and to be very transparent, we've had individuals that, not once have we in St. Joseph County had a vaccine reaction that required hospitalization. Okay, not one. Okay. However, we have had a fair amount of people that have gone to the ER because of their anxiety around it. Because think about it, there's a lot of things in your head that you're trying to siphon through and get through some of those feelings. That's where we say, how can we best educate? How can we find the best resources? I'm working on a bendable collection for the library that will have 7 amazing spots to find information on COVID-19 vaccine, on the variants, on everything COVID related, just because it is so extremely valuable in being able to identify what information is correct and current, but then how to interpret it, right? A lot of times there's things, for example, I just found out that my father-in-law has prostate cancer, and luckily it's very, very early, but still my mother-in-law is like, I don't understand any of this. What they gave me all this stuff but I don't know what it is, right? So it didn't matter that they gave her information if she couldn't use that to the best of her ability. And I think that's what happens when you see things on social media and you get things on your phone where it pops up with the news alert and they're like, B117 is now mutating. How do you know what to trust? And the pandemic has been very rocky in itself, with lots of information. We know a lot more about COVID-19 than we knew 10 and a half months ago, which is why things change over time, right? Once you know better, you do better philosophy. So that's where we see even with the vaccines. One of, I think, the biggest changes most recently is we can do, you can go longer days between doses. So we had a little scare with the snowstorm last week. Several of our vaccine clinics, not ours in our region, but in Indianapolis, had to cancel their vaccine clinics. And there were individuals that were calling us concerned because they wanted to get their second dose and make sure they got their second dose. And one thing we are identifying is that an immune response occurs with that first dose. And you get an even better immune response when you get the second dose. But the timing between those two can actually be a little bit longer than just that 28 days. I believe with Moderna, it's up to 44 days. Which, especially with our older population, I've been amazed at how many individuals I speak to each day who've had something happen that's now prohibited them. I spoke to a woman today who, unfortunately, her mother was scheduled and had a massive stroke and wasn't going to be able to come in for her second dose. And her daughter's like, oh my goodness, what if she can't? Well, they just have to give her another dose. And my first thought was, don't worry, make sure your mom's okay. When she's ready, we'll get her second dose. So there isn't really that fear. I know a couple weeks ago, there was a news article where I believe the federal administration came out and said, let's just give one dose to everybody and then let the second dose come as we get more allotment. The more and more we look at immunity, there is some value to that discussion. Let's vaccinate everybody so that at least everyone gets a little immunity. And then as the second dose becomes available, give people that quote unquote booster. But Indiana's not choosing to follow that plan. The federal government's not choosing to follow that plan. But in the event that I think we got hooked up again for a vaccine allotment, we would probably utilize a similar concept of that one dose and then get the second dose as more vaccine comes online. And again, it's just because we know more. And I think because of the mRNA technology, it's your body's reaction to something it's being told to do. So it just has a heftier immune response. If we look at comparison, the flu vaccine on average is anywhere from 60 to 75% effective each year. And what that does is it's effective in preventing severe sickness from influenza. Okay. It's very similar to COVID vaccine where it does not say that it prevents transmission, but it reduces severe complications, which when you look at viruses and infection, it all comes down to viral load. Somebody with a lighter viral load, which means no symptoms or very minor symptoms, is going to have less virus to spread. So in that way, you could say it reduces transmission because you don't have as much to cough or sneeze out into the air where somebody else would breathe it. What we see in comparison is our COVID-19 vaccines, both Pfizer and Moderna, are extremely effective in preventing severe COVID-19 infection. So what that means is individuals with Pfizer, 95% of individuals who have received their full two doses of the Pfizer vaccine, only 5% of them have developed severe COVID-19 infection, but no one has died from that infection, which I think is key. With Moderna, it's even higher, it's 100%. So of that original study group of 30,000 plus participants, no one developed severe COVID-19 infection. And that's ultimately what we need to do. We need to prevent severe COVID infection, which ultimately leads to an overwhelmed hospital system and in healthcare infrastructure, but even more importantly, death. And if we can stop death, and yes, individuals still potentially run the risks of becoming infected and then potentially transmitting the virus to other ones they love, we still have to practice the mask wearing, the physical distancing until we get to an amount of vaccine levels where we can begin to lower down those other mitigation strategies. Pfizer and Moderna both have shown the same thing with the viral load that I just mentioned. So individuals who receive the vaccine, if they do become infected, have less viral load, which means that transmission is decreased. So there was in the very beginning, there's a term, it's not a great term. And again, it goes back to context, but it's called sterilizing immunity. Now, most people have taken that and said, sterilizing me, oh my goodness, if I get the vaccine and I'm a childbearing age, I'm not going to be able to get pregnant. That is not what we are talking about. We are talking about the ability for a vaccine to stop transmission from somebody who's been vaccinated. And that ultimately is what we call sterilizing immunity, because we've sterilized them. They're fine. They're not going to become asymptomatic and pass it without knowing. Okay. And we do see that there are individuals who are fully vaccinated that do test positive for COVID-19 due to natural infection. But again, the likelihood that they're going to get severely ill is dramatically decreased. So that's the value in itself. There is, now I know that I'm vaccinated, I'm protected, I'm not going to die if I get sick. I will personally attest to this because I have type 1 diabetes. So literally for months I was on edge, like, oh my gosh, if I get sick, and I have small children, I thought if I get sick, I'm at risk. Am I going to go in the hospital? Will I be one of the people who get really sick? So when I received my second dose, and I literally crossed off the days before my 2 weeks, right? Because they say full immunity occurs after the second dose, after 2 weeks. I was like, whew, okay, now if I get sick, it's okay. I'm not going to die from it, which is a little bit easier to swallow. I don't want to get sick, but it's a little bit, whew, I at least can breathe a little bit of a sigh of relief. We've had people come in to the clinic that will be very emotional because they haven't seen loved ones for the whole year because they've been concerned. And so I think that is another piece that the vaccine is bringing to a lot of us, is a little bit of hope, of a little bit of normalcy, a little bit of getting back what we liked and what we loved. But then it's also understanding that this vaccine protects you from getting severe COVID. However, we are still studying the rate at which transmission occurs with those that have been immunized. Second, to Kim's question about the variants. And the interesting thing with variants is, and why we have, I think, even some of the variants are, so viruses are very good at keeping themselves alive. And each time, and hence why we say take all your antibiotics even when you start feeling better, is because every time a viral or a viron is what they call themselves when they're inside the cell, infectious material replicates, there's the opportunity for mutation. And over time, if there's enough, and then I'm sick and I pass on that mutated piece of infection, now that's going to be the infection that somebody else is going to get, right? And then it just kind of catapults, okay? And perfect examples when we look at SARS-CoV-2, COVID-1, right? This was back in 2003. Extremely fatal, like 80% fatality rate. We saw about 400 cases in Asia. That's when they started developing coronavirus vaccines, is in 2003. So they've actually been working on coronavirus vaccines for almost 2 decades. The difference with this is we were in the middle of a pandemic and had unlimited amounts of resources. So institutions that had been studying coronaviruses and coronavirus vaccines didn't have to wait for that 4-year grant cycle to come around and then not be awarded it and have to wait another 4 years, right? So instead, the federal government said, you know what, there's exponential amount of resources. We just have to figure out how to do this. So vaccine corners were not cut, or trials were not cut short. Everything was followed to the point in which it needed to be done for safety, for effectiveness. I think the piece, if anything, is we were able to start using it faster than we would have, because again, we had the emergency use authorization, which is there for these types of things. We knew it could, and I think that's why with the types of vaccine we're delivering to individuals, utilizing that technique allows for there to be less adverse reactions way down the line, right? Because that's what I hear a lot is, I'm going to let somebody else take it, and then maybe a year, I'm going to see what happens, and then I'll do it. But again, speaking to the mRNA piece, kind of it eliminates that potential of what will come down the road, because the mRNA is something that's very, very usual to your body. Okay, so the variant piece, we see with Pfizer, they actually still are protective against the newer variants that are evolving. Moderna is also effective. It decreases their effectiveness a little, but they're still there. They're still saying that they are effective. It's still valuable to get the vaccine. We need vaccine uptake to occur quickly so that more variants don't continue. So the variants are linked to our response this last year. It took us a really long time to get things under control. They're still not under control. And therefore, that laid the way for these mutations, because it happens based on the rate at which the virus is transmitted. Okay. And we've seen exponential numbers of transmission throughout the world these last 5 months or so. So that's where the variants come from. But yes, the vaccines will protect you against those. And Moderna is working on a booster, actually, in the event that their vaccine would not become effective. They're working on an alternate sequence so that it will be effective, which I think is extremely important. And then when there's 3 other vaccines that are looking, I believe Johnson & Johnson will have emergency use authorization in the near future. That's a single dose vaccine. Effectiveness is about 62%. So I would probably relate that back to something that's similar to our flu vaccine. So still effective if it's all someone has available. I'm like, take it. And then when there's Pfizer and Moderna are available, take that, because something's better than nothing, especially when we're looking at controlling the spread of this disease. Suzanne, does the vaccine actually prevent you? Oh, I'm so sorry. I've been up since 4 a.m., so I apologize. And I know I mentioned this again, but I'm gonna talk about it again because it's super important. Both current vaccines, Pfizer and Moderna, protect against severe COVID infection. So they minimize the symptoms, yes. And we're still waiting to see at what rate they prevent transmission. So we're beginning to see some early signs that say, yes, they decrease viral load, therefore they prevent transmission. But we're gonna need a few more months to continue to see those results, to see, well, we need more people vaccinated to see if that's really the case, okay? So hopefully that makes a little bit more sense. And then Kim asked, what do the clinics expect of volunteers in terms of time and commitment? So for volunteers, we are looking for really anybody over the age of 16 who wants to spend time with us. We are looking for someone who's willing to at least take a dedicated maybe shift on a specific day. So maybe every Monday from 8 to noon for the next couple of weeks. So just so we can build in that consistency that allows us to shift health department staff to potentially offering other clinics or more clinics. Mobile clinics have been put on the table for us to reach harder to reach communities. So we would be able to utilize them. So our clinic runs so smoothly, and I highly, highly suggest, if you have the time to volunteer, to volunteer. It is such a happy place. Even health department staff are like, I don't want to go to the office, I want to go to the clinic, because everyone coming in is so grateful. They're so excited, they're happy to be there. And it just runs smoothly. We got really good music that plays. Your whole experience is quick. The longest time it takes is the 15 minutes of observation that we do. And during that time, that's when we set you up for your second dose appointment and all those types of things. So yeah, it's fairly easy. Individuals sign up online through ourshot.in.gov, where you will choose a category of eligibility, and then you can choose your location. We have 14 locations throughout St. Joseph County as of today. Several of them will use the same system we use at Hedwig Memorial Center. However, Sam's Club, HealthLink, Kroger, they do not. So you can, yes, still register through the online portal. They just may have an extra step. So it might say, call this number to schedule the appointment, rather than going in and scheduling it all online yourself. If you do need assistance with scheduling, the library has been trained on doing that, and they've really stepped up to the plate, from getting trained on the Zotec system to answering all the calls all the time, even when they don't know the answers, have been phenomenal. So that's a resource. And then 211 as well. It's just harder for 211. They're a statewide system, so they tend to be a little bit more bogged down with calls. So people call, I had to wait 40 minutes. So I say, call the library, have them help you if you need help. And then lastly, if you just can't figure it out, call us at the department, and we'll help you. I've heard immunity from actual infection may last for 90 days or so. That's a really good question. So the question talks about immunity and how long immunity lasts. So immunity from natural infection, what we know for certain is the majority of individuals with a natural infection from COVID-19 will have immunity for at least 90 days. Okay. We've also seen that some individuals can have immunity for 5, 6, 8 months past infection. And what we are beginning to see is a lot of that depends on the response they had when they were infected, which we didn't know to look at that until now. So when we think of the vaccine is creating a similar response, but it's basically it's like calling up an army without needing the army. So your mRNA has your cells create this antibody to this spike protein that doesn't allow COVID to bind to any of your cells, okay? It creates this army without ever actually coming into contact with SARS-CoV-2 or the virus that causes COVID-19. So in the event when your body comes into contact with it, that army is ready and they deploy, and maybe you get a sniffle, maybe you get nothing at all, okay? So the immunity from natural infection and the immunity from the vaccine are somewhat different, okay? One's not better than the other. I think the vaccine carries a little bit more robustness because you're getting that first dose and then boom, you're getting that second dose as well. But that is something we're still looking at. That's a question I get a lot. Will we need the shot every single year? It depends on how quick we take this vaccine. I really think it depends on if we get control of the variants. If we have very slow uptick to this vaccine and there are more variants, there's a very good chance we'll need a booster shot in a year. If we have really good vaccine uptake and the variants are stopped somewhat in their track, we may not need a booster ever. Maybe our bodies will just become used to this virus like we are to other coronavirus, which actually causes the common cold, okay? These things will adapt. So that's where we're looking at. But I think that's why Moderna is trying to get ahead of the game and say, in the event we need a booster, let's have one ready so we can get it out to people. But that's a good question. Other questions?
I think it's okay if people just unmute too.
Oh, yeah.
If you want to, you can type or feel free to.
I would love to hear everyone's voice.
Just us, we're friendly.
Oh, good. Thank you.
That was really, really interesting, Robin. Thank you.
Good. And there's so much, and I'm just hopeful that we can do these more frequently. More people ask questions because, it's really going to come down to how well we can do this to turn, this awful page behind us. And every day I think to myself, when we are on the other side of the mountain and we need to start thinking about what we would do better, I hope we address all these things, right? And I'm hopeful that that's something we can do. It's
a learning experience. It's a learning experience.
Yeah.
But I think it really helps to understand, when you explain it, it's just interesting. And I think it makes it a lot less scary to think about getting a vaccine, getting a shot. It becomes really just, I feel so proud that science achieved this, it's really impressive. And that's the bright side is we learned now. And
very much so. The first dose of vaccine I got, I was like, oh my gosh, finally. I felt a little bit of relief. And then that second dose, I was like a blubbery hot mess.
Oh, yeah.
I was like, oh my gosh. And before I know it, my parents are going to be able to get it and they're going to be protected.